A listener opened their chest x-ray report and saw scattered airspace opacities, and their stomach dropped. Hi, I'm Jess. I read these reports every day, and today I'll show you how to tell worry from urgency. Quick note before we begin. I'm a family nurse practitioner and legal nurse consultant. I work with clinicians and attorneys, and my goal here is practical clarity, not to replace your clinician, but to help you ask the right questions. Let's start with a simple habit that changes everything. Read the impression first. Seriously, read the impression first. It's not rude, it's efficient. Reports follow a simple pattern. Trust me, it helps. Top line, the exam, what was done. Next, comparison. Are there old images to look at? Findings, the radiologist's detailed notes. And finally, the impression, the short, prioritized takeaway. Read the impression first. Yes, first. Why the impression? Because radiologists prioritize there. They'll say what looks urgent, what's chronic, and what might need follow-up. Think of it as the headline. The rest is the supporting paragraph. Okay, words. Some of them sound scary, but aren't. Others deserve immediate attention. Let's decode the most common phrases you'll see. Nonspecific. That one's a classic. It usually means the image could fit several causes, and the picture alone can't decide which. Infection, inflammation, scarring, any of those might look similar. The image is one clue, not a verdict. Consistent with means the finding matches one diagnosis better than others, but it's not absolute. Likely or probable bumps the confidence up a bit. Suspicious for sounds more serious and usually means further testing is recommended. You'll see incidental a lot. Good news, incidental usually means it was unrelated to why the test was done and often won't change immediate care. A tiny kidney cyst on an abdominal CT, usually incidental. Not always ignored forever, but likely routine follow-up rather than urgent. You'll see recommend correlation clinically. Translation, the image might hint at something, but your symptoms and exam matter most. It's not a dodge, it's a safety check. I say that because I've seen imaging misread when taken alone. Don't let that happen to you. Now, red flags. These are words or findings that usually deserve same-day attention. Acute, new, consolidation suggesting pneumonia, pneumothorax, which is air outside the lung, large effusion, meaning a lot of fluid, or phrasing like concerning for pulmonary embolism or suspicious mass. If you see those, call your clinician today. And the other side, language like chronic appearing or stable compared to prior, usually means routine care. But here's the rule. If you feel worse, trust your symptoms over a calm-sounding line. Your body is part of the picture. You do not need to accept confusion. You can ask for clarity. Say that to yourself now. That's part of being a good patient advocate. Scripts make this easier. Use them word for word if you want. First, urgent script. Hi, this is your name. My CT today mentions a new or acute finding. It says concerning for acute consolidation, pneumothorax. I'm concerned and would like to speak to the clinician today about next steps. Clear, specific, and it signals urgency. Second, clarification script for vague wording. Hi, I'm calling about my imaging report that says nonspecific and recommend correlation clinically. Can someone clarify what that means for my care and whether I need follow-up or testing? This moves the question from the page to a clinician. Third, requesting images or a second read. Hello, I'd like a copy of my images and the report. Also, can radiology do a second read, or can my clinician request a specialist radiologist review? If it's a complex finding, a second read is reasonable and common. And a tip on how to get traction on the phone? Call during business hours. Ask for the triage nurse or the radiology clerk if you need the images, and leave a callback number. If you don't hear back in the time frame they promise, usually a few hours to one business day, call again and reference your previous call. Practical logistics. Save reports to your patient portal. Request the DICOM files or a CD when possible, and bring copies to in-person visits. If a report contradicts your symptoms or prior history, ask your clinician to document that concern and consider further testing. Don't leave with unresolved worry. If you find an error in a report, be specific. Quote the exact line, say what's wrong, and request an addendum. Radiology departments and your clinic can add corrections. This matters for future care. A realistic limitation. Images don't read symptoms. Radiology is one piece of the puzzle. Labs, history, exam, those shape the diagnosis just as much. If you're unclear, ask for an appointment where the clinician reviews the images with you. Seeing the picture together removes a lot of anxiety. Before we finish, 3 takeaways you can use right now. 1. Read the impression first. 2. Flag words like acute, new, consolidation, pneumothorax, or suspicious mass, and call your clinician about those immediately. 3. Use the scripts. Ask for clarification, request images or a second read, and be specific about what you want. One final practical habit. Keep a short log. Note the date you called, who you spoke with, and what they promised. If follow-up slips, that log gives you leverage to get care scheduled. If this episode helped you feel steadier opening an imaging report, please subscribe so you don't miss future nurse-led explainers. Share this with someone who gets anxious over medical wording. It really helps. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynurseJessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.